I just remember flying off this jump, my feet go out from under me, and after hitting the ground, time kind of just stopped. I remember looking up at the sky and genuinely thinking that my life was over. When you go through a traumatic injury like this, a lot of people ask, how are you feeling? Where is your pain? But they don't really consider the emotional recovery that's really involved with this type of experience. So it was a Wednesday morning. Me and 3 friends decided to go to some small mountain in Pennsylvania. We decided to go down the terrain park, and we see our 2 other friends just flying off these jumps, and I'm sitting there thinking to myself, like, I want to be going off those jumps.
I'm behind Maeve, and all I see is her full send and have this confident ass ride up the pipe.
And I fly 10 feet into the air, straight up, and my body's completely parallel to the ground. And that was when time kind of just slowed down to a point where I was able to process what was happening, but not able to react in any sort of way. It was kind of just like I was witnessing this all happen. After coming down and hitting the ground, I had a helmet on, thankfully, and my head bounced off the snow and caused this severe whiplash when my chin came back to my chest.
I snowboard up to her, like scoot up to her, and I kick her. I'm like, get up. I'm like, what are you doing? Like, you're in the middle of the landing. Like, we can't do this. It took a minute and a half for her to even say anything or like look me in the eyes. So it was like I could tell that like it wasn't like she wasn't okay. Like, it wasn't like she could just like pop back up from it.
Lindsay comes up to me and it kind of snaps me out of the haze that I'm in. And the first thing that I do is start wiggling my toes and my fingers around to make sure that I can still feel everything. They start moving and I'm like, okay, I'm fine. You know when you get hurt and there's that voice in your head that's like, you know what, you're fine. You're just in shock right now. You just gotta sit out a little bit, shake it off. That's kind of what was going through my mind. And because of that, I had originally just planned on riding down the rest of the mountain and then sitting in the ski lodge for a little bit and, kind of just waiting it out.
She's like convincing herself that she's okay, and like we're also like not helping because we also think like there's no shot, like she's okay, she can definitely get up and like make it down the mountain at least. And then we had to make the decision, like we were like, no, let's just get help, let's just be safe, like just in case. They were assessing her, and eventually she was in a gurney, and like it was all shits and gigs, and like we were taking pictures, and she was like, no, I don't want a picture, and we were like, no, you're gonna want it for the memory.
We get to the ER, I get taken to go get CT scans and x-rays done.
When the doctor walks in, we were doing a TikTok dance, like just like messing around, and then he lays her down and he's like, okay, your neck is broken. Maeve was looking at the ceiling, and then me, Tara, and Isabel were looking at each other with our mouths dropped. We were like, no way is her neck broken. Like, we couldn't believe that we like completely underestimated it.
He tells me that my neck is broken, and I just immediately go back into that shock of, wow, like this is serious. The neurosurgeon at that ER that I went to had told me that it was just a hairline fracture in my C5 vertebrae. After going and seeing a different neurosurgeon a few days later, I learned that it was actually a teardrop fracture, or an unstable fracture, which would result in me being in a hard collar brace for the next 3 months, and a possible spinal fusion surgery. I don't think that I fully realized the severity of this injury until meeting with that other neurosurgeon. I fractured my C5 vertebrae, and frankly, I was lucky to have avoided any spinal cord damage or even just paralysis. Because my fracture was unstable, I was told throughout my recovery to look for any numbness or tingling in my arms that I experienced, which would mean, hypothetically, that something's moving in my neck that's not supposed to be moving. And I think that's what made my injury and my recovery so scary, is coming that close to losing the ability to walk. I was an athlete my whole life. I was a gymnast and a diver, and I would do these crazy flips and twists with no second thought. I would just, someone say, go do this, and I would do it. I kind of just had this fearless approach to life that contributed to this feeling of feeling like I was invincible or, like it can't happen to me. But everything changed after my accident. I went from being this daredevil who would do flips off bridges to somebody who is scared of getting pushed too hard. My physical therapist played a huge role in helping me heal both emotionally and physically.
When we hear about a cervical fracture, we think spinal cord injury, and we think paralysis, and we think things that are really, really extreme. Just having our neck be injured is a really sensitive part of our body. Our brain's going to go to the deepest, darkest place when we think of having a cervical fracture. The main anxiety that Maeve was dealing with was just that fear of making the injury actually worse, whether it's making the fracture worse or actually making it worse enough where you're going to sustain an actual spinal cord injury. So to think about, the fear of kind of making it worse, we have to slowly build up our confidence by doing easy enough things that may be challenging, but we can still do successfully, that don't cause pain or just super, super high amounts of fear. One of the things that I think helped Maeve throughout this process gain her confidence to get back to doing snowboarding again and other just normal activities that she kind of does is like the education piece of things. Oftentimes when we kind of go to a medical professional, they don't necessarily sit us down and kind of like actually show us what's going on and explain it in a way that is understandable for the patient or for the client. Maeve and I kind of pulled out the anatomy book and went through the actual anatomy of like where the injury was, what kind of things can affect it, which I think helped kind of decrease just the anxiety that she felt about it, because once you have an understanding of like what's actually going on, things just seem a lot more normal. The kind of fear of the unknown goes away once you have an actual idea of what the actual injury is, and again, why it kind of happened in the first place. The difference between the first time I met Maeve and kind of our last treatment session before she was back to school doing her thing is pretty stark contrast, just in terms of like the anxiety and fear and just what she could actually physically do that first time compared to the last time.
Aside from the trauma of coming so close to losing the ability to walk or the fear of worsening my injury, my post-traumatic stress really centered around the fact that I almost ignored the signs and continued going down the mountain. My neurosurgeon told me that if I had continued going down the mountain and had fallen again, that I would be in a much worse situation. Since my accident, anytime I've been injured or just felt something off in my body, my initial response will be like, you're fine. But then there's just this voice in the back of my head that's like, what if you're not fine? Look what happened last time when you thought you were fine and you almost didn't get the help that you needed. Like, that could have just been a much worse situation just by avoiding the fact that, maybe I'm not fine, maybe I should go get seen for this.
Triggers are a major component of the aftermath of a traumatic experience. In your case, the context and specific injury which you sustained are likely triggers to some degree. Individuals who sustain an injury are often protective of the injured area, and any contact to that area might provoke a mild to moderate emotional or physical response, recoiling, for example. A key point here is that triggers can be highly personalized and that no two traumatic experiences are wholly identical.
People assume that my anxiety and my post-traumatic stress is related to snowboarding or never wanting to snowboard again, but it's actually much more complex than that.
It's not always true that individuals will feel any degree of comfort being re-exposed to a stimuli associated with trauma, especially if the traumatic event is a series of events. In your somewhat unique case, you've characterized yourself as someone who loves skiing and being on a mountain more generally. As such, you've had many, many positive experiences on a mountain. One of the ways we think remote memory works, that's memory for time in the distant past, is akin to that of a mental average of events. If you take your one negative event and couple it with the several dozen positive events, it's likely to somewhat dampen the effect of the negative event in the long term, and your behavior in response to that context would remain unchanged. This is one of the many reasons why a surfer who is attacked by a shark may get back on their board with little hesitation. They at least partially recognize that the attack itself was a statistical anomaly.
Even though my injury made me a lot more reserved and cautious, I didn't want it to change who I was or make me fearful of living life. If anything, my experience made me much more grateful and appreciative of the time that we have. It just made me have a different perspective to really live life to the fullest because you never know. During my recovery, I found a therapist, and she really helped me kind of like navigate what I was going through and also have a better understanding of what I was going through. When I originally went to my parents and told them that I thought I was dealing with post-traumatic stress, their initial response was like, "What do you mean? You're fine." And, I can't really blame them, because at the same time I was telling them, like, I can't wait to go back on the mountain and go snowboarding again. So in their eyes, they're like, how does that add up? I think because of our generational gap and difference in societal mental health perceptions that we had growing up, it was difficult for them to really understand what I was going through. Additionally, it just made me much more aware of the stigma surrounding mental health and the negative effect that they can have on those individuals who are struggling.
So trauma, whether it meets the clinical criteria for PTSD or not, should be treated akin to that of a broken bone. All humans have brains, and those brains are prone to injury. The difference, of course, is that it can be difficult for other people to recognize that a traumatic event has occurred if they didn't experience it firsthand. Also, it's nearly impossible to point to your own brain to show someone where you were hurt in the case of a traumatic experience. To someone suffering from PTSD, stigma can be frustrating and disheartening. We certainly don't stigmatize people for breaking bones, as we know that bones are prone to breaking in certain circumstances. It stands to reason that we shouldn't stigmatize mental health disorders because we have a nervous system that is equally prone to injury in certain circumstances.
So over the past 50 years, one major change has been the shift in the society's attitudes. So people are becoming more accepting of mental health problems and more supportive of people with the mental health issues. So for example, my parents used to say, mental health is not real. If you are struggling, it is because you don't work hard. However, now we know that mental health is real, and it does actually affect people's well-being, both mentally and physically. In other words, I think people are more aware of common mental disorders, such as depression, anxiety, and PTSD, and are more willing to talk to their close others, discuss with health professionals, and seek treatment. So I think those changes are partially attributed to the increasing media coverage about mental health. Even though there is an increasing media coverage about mental health, I think the media often stigmatized, either intentionally or unintentionally, people with mental health challenges. In addition, the media tend to focus on the individual with mental health issues rather than framing mental health as a social issue, and therefore the media customers oftentimes blame an individual for the issue. So I think all of this contribute to the creation and dissemination of stigma about mental health. Because the media stigmatized people with mental health challenges, those who are struggling may internalize the mental health stigma, which could amplify the negative consequence of mental health disorders. And in addition, because of the fear and other negative emotions related to mental health, people who are struggling may be less likely to seek for treatment and talk with other people about their challenges. And study did show that untreated mental health disorders has profound consequence on people's personal relationships and individual well-being.
It was really frustrating and isolating to go through this experience and not even have much of an idea of what it was I was experiencing or ways in which I could manage it due to the lack of representation in the media. Thankfully, after learning more about what I was dealing with and going to therapy, I was able to better communicate to my parents what exactly I was going through, so that they would have a better understanding of exactly what I was experiencing and why I was experiencing it. My parents have always been my biggest supporters, so it made a huge difference for me to feel comfortable telling them what I was going through and to feel understood by them. I wanted to make this documentary to raise awareness to mental health by sharing my experience and being raw and transparent about these issues that are much more common than we believe. Before my accident, I thought I was invincible in more of a physical way, but through my recovery and with lots of love and support along the way, I learned how to be more emotionally invincible by not allowing my struggles or challenges to overcome me.